الله الله يا الله الله حق الله يا الله حق الله الله يا الله الله.
Assalamu alaikum. This is Sajida Khan from the Islamic Foundation of Toronto, Social Services Coordinator and the Seniors Program Coordinator. Ramadan Kareem to you all. Since the past 7 years of consistent and successful programming, 2020 was a time of uncertainty for all of us. The unexpected and deadly virus struck us not knowing in which direction we will be moving. However, no matter what the global situation is, we learn to survive. We educate ourselves according to the probabilities and take immediate actions to save our life. Considering the situations, we had to make a makeshift for our programs. Zoom came in at the right time. We introduced Zoom programming to our seniors. We wanted to make sure they are not left isolated, they are not alone. Since we are all in this together, we had to come up with new programs. So Zoom program was introduced to our seniors, and they are now enjoying virtual programs each week. Wherever we can see our seniors and speak to them, the platform brought a ray of hope to the seniors, and moral support plays a great part in maintaining one's sanity. We follow best practices while delivering our programs. Programs we conducted every Monday and Wednesday for 1.5 hours. Seniors logged on to Zoom. They learned how to utilize this new technology, the new program on Zoom, and they were very excited to meet everyone every Monday and Wednesday. The sessions were all informative. Considering the current COVID-19 situation, we educated them about COVID-19, about the whereabouts, and how they could get over this situation by keeping themselves safe at home. The program consisting of 1.5 hours, 1 hour presentation sessions, meet and greet, and half an hour of physical exercises. Physical exercises were of great help to them as they stayed within their houses but still maintained their physical health. Various programs were delivered through Zoom. So far, during this year, 15 mental health sessions were presented to them on maintaining their self-care, managing themselves. Since most of them lived alone, we had to make sure we created this confidence in them to join the program and make sure that they are maintaining a good health. Professionals like doctors, pharmacists, health and wellness coordinators, physiotherapists were all invited for these presentation sessions to educate our seniors on self-care and self-management. Like everyone else, we all had misconceptions about the vaccine. But thanks to our pharmacist, Muhammad was invited to the presentation. He presented about the COVID-19 vaccine, and we were all safe and we were talking about the vaccine. He answered all the doubts and questions that were trolling in our minds. At the beginning, none of us wanted to take the vaccine because, yes, we did have our own opinions. But down the road, we found that these vaccines were safe enough for our seniors, and they were mentally prepared, they were mentally educated to be ready to take the vaccine once they rolled out in the community. For now, most of our seniors have been taken the first dose of the vaccine, and they're all impatiently waiting for the second dose. During this time, we introduced various projects. One of them was the United Way project, which was titled Circle of Hope. Circle of Hope was a unique project in its own way. The objective of this project was to supply groceries and pantry items to the seniors to make sure that they do not leave the house to the grocery stores, as there was a fear of having this community spread. Items for the hampers were chosen based on ethnic choices and usage. Our volunteer team was steadfast in personally coming to the masjid during these times, but with complete precautions and maintaining social distancing while we prepared these hampers. The volunteer meetings, discussion, grocery shopping, packing hampers to distribution got us a new ray of hope to stay connected with our group and the community at large. We made sure that we communicated with our seniors during this time. Telephone calls were made to them on a weekly basis. We followed up on all our seniors, and they were very excited to hear us, and everybody had a ray of hope that once the situation gets back to normal, we will be back into the program. Now, these hampers that we tried to prepare were distributed on a monthly basis for the past 6 months. And this led to stay connected with our seniors as these hampers were dropped off to their houses. Drive-ins were encouraged for mobile seniors. A team of 18 police staff joined us in making the first set of hampers, and 50 volunteers from IFT were involved in this project. 159 different items were purchased that included grains, pantry items, canned food, various oils like olive oil and vegetable oil, healthy snacks, chocolates to make sure that they maintain a good mood, cookies and hygiene items were packed in these hampers. During the entire duration of this project, we were able to distribute 500 hampers each month to seniors and social service recipients. A total of 200,000 pounds of groceries was distributed. This was a great achievement as this was a new project to IFT, and all the possibilities of the volunteers coming together, packing the hampers, distributing them, made it possible. Hygiene hampers were also to be prepared during this time, keeping in mind that hygiene was much more given importance to during these times of COVID-19. Hygiene hampers consisted of body wash, washing detergents, wet wipes, soaps, masks, and oral health items were all distributed in these hampers. Meal packs for homeless in downtown Toronto, how could we forget them? So we made sure that every week we were packing hundreds of meal packs, and our generous volunteers, brave volunteers, were able to drop them off at downtown Toronto. And we could see the excitement in the eyes of these community people in downtown Toronto. They were excited to receive something on behalf of the masjid. After that, the volunteers decided about the Ramadan hampers. To enhance the program, we always come up with ideas to surprise our seniors. And one of that was Ramadan hampers. Why Ramadan hampers again? Because during these COVID crisis, we wanted to make sure that they do not leave the house again for any Ramadan essentials. And at the same time, we wanted them to enjoy Ramadan full-fledged in any possible way that we could do it. So Ramadan hampers came into existence, and this consisted of items usually used during the fasting month. Volunteers stitched 180 prayer veils because we knew all the shops were closed and people could not go outside to purchase new clothing for Ramadan. So that was the least that we could do for our seniors. A team of 10 volunteers stitched 180 prayer veils for the female. 400 coasters we made. They wanted to utilize this time, and they used it very effectively. Prayer mats, nuts, other goodies, indigenous handcrafted items from the Wetong Ojibwe, like handmade soaps, handmade brooches, bead items, were all part of this Ramadan hamper. And the seniors were overjoyed, delighted to find this hamper. Our next project, as the United Way Project Circle of Hope, was a great success. Everything has to come to an end, and that project also came to an end after the distribution of these hampers that were done very successfully. Artsy Aging was another project that came into existence, and this project is all about involving the seniors in creating art, to be creative and learn the art of painting brush strokes, color to avoid COVID blues. Now, because the stores are closed, however, we will be distributing these hampers to them in the following weeks. Painting material will be given to them, painting boards will be given to them, and virtual painting sessions will be delivered on the program every Wednesday. Armor for Aging is another project which is new again, and we focused more on technology. During this time, we wanted to make sure that they have learned Zoom, they have learned how to use iPhones, they have learned how to circulate their messages on WhatsApp, taking pictures, sharing the pictures with families and friends, recording messages. We have seen all this improvement in our seniors during this time. They used to call each other to learn about these apps, downloading these new apps and learning to utilize them. And this has given them a bit of motivation in being able to learn technology from youngsters and friends. So Armor for Aging is all about learning technology and improvising themselves, since it's the time of technology now. The seniors have become tech savvy now, and they stay connected with each other with confidence. Another project again, I think IFT was blessed to have received funding from various sources during this time to introduce many projects that I have been informing you about. Another interesting project is age-friendly communities. Now, creating an age-friendly community. What is this? Since we see that we have people of different generations living in a community, but all of us utilize all of these services. Seniors utilize the library, children utilize the library, youngsters utilize this library. But however, can we make this an age-friendly community? Now, the reason behind this project was for us to come up with the idea of creating an action plan that the seniors could be able to voice their message, to share their message with the government, to let them know the gaps that are being seen within the services. Now, our senior program had started off as a social platform to meet and greet old friends and family. Now, as we entered our 8th year of programming, our seniors have become well versed with the structure of programming. When we would invite them for program, they would ask us, what is this program about? Why do we have to come? How is it going to benefit us? But today, they understand the value of community programming. They understand the value of engaging themselves in programming. And this program has probably changed their lives. It has changed their lifestyles, and it has brought not only physical health to them, it has brought also a strong mental health capability. They are able to live alone. They don't miss the children as they used to miss a lot. As the children, when they invited them for the vacations, they would say, no, we would like to stay with the group as we are having a lot of fun with the programs. So they understood the value of programming. They understood what the program is giving back to them by just joining the program, by just coming to the IFT cafeteria once a week, or joining the Zoom program. These programs have really enlightened their lives. Simultaneously, this program, which is the age-friendly community project, will really highlight new possibilities for our seniors to create an age-friendly community. Now, be it the mental health presentations, awareness about the Canada and its history, environment, chronic illness, falls prevention, self-management, you can discuss these with our seniors and they will respond to you with confidence. Now, with the age-friendly community grant, we will be conducting a research project to create an age-friendly community and improve access for all seniors. And especially when it is seniors are aging, their needs, their necessities will definitely be different from what it was 10 to 15 years ago. And it's only the seniors who will be able to voice it. Youngsters or other adults may not be able to understand them completely. So this is a platform where the seniors will be getting a chance to express their needs and necessities. Creating an age-friendly action plan. The seniors are going to play a very important role here in shaping a safe and friendly community for all. So what and how are we going to execute this project? In this project, we will be doing a survey. We will have 3 types of surveys. One will be on SurveyMonkey, and the same survey will be distributed to the seniors because this is to collect stats. And we have decided to complete 1,000 surveys. So once these surveys will be distributed, we will collect the stats in the first semester of the project. And the stats will probably be about asking them about their age and the community that they live in. Our second quarter for the research is going to be a focus group. We are going to conduct focus groups, asking them various questions. What the questions will be about? The questions will be about their neighborhood. Is it safe to live there? Do they feel safe walking at 9 o'clock in the night? Are the street lights bright enough for them to walk in the night time? Are the libraries welcoming? Are the clinics welcoming? How are the staff around in the medical facilities treating them? Because we would like to advocate for respect. We would like to advocate for priority. Most of the time, these seniors live alone. They use the wheel-trans. Sometimes the wheel-trans is late. Sometimes the wheel-trans is on time. So how do they cope up with all of this? These are the needs assessments and the research information that we will be collecting from the seniors. And the third phase of the research project will be a focus group for service providers. Service providers are the people who deliver the services to these seniors. They're doctors, they are mental health workers, and they're physiotherapists, and they are librarians, and they are home care officials. It can be anybody who is providing a service to the seniors. So we will not only hear it from the seniors, but we will also hear it from the service providers to make sure that we fill the gaps and create a unique, a beautiful, and a safe community for our seniors. So they will be playing a role of advocating for themselves, for their needs, for their necessities, to create a safe environment for their rest of the life. So hopefully, we are very confident that we will be able to create a beautiful and a very important report that will be helping the government officials in creating a beautiful and safe community in Scarborough. So Islamic Foundation is playing very important roles in creating not only a safe community, but a safe neighborhood. Safe neighborhoods, safe communities rely on people like us to find out more about how we can create this change. That was all from the social services, from the seniors programming. Moving on to the social services. Social services is again a wide array of services that we provide within the community. As part of the social services program, we provide settlement services to newcomers under the refugee program, which is an extremely important program. We rent apartments for refugees even before they land in Toronto. Before the families arrive, we make sure that all their necessary essential items are placed in their apartment. IFT staff welcomes them at the airport. We pick them, we escort them from the airport to their apartments, and we make sure we explain the necessary and the important context that they would require during their stay here. We do an orientation for a settlement process for them to make sure that they are safe, to make sure they understand how the system works, to make sure how they can utilize the transportation facilities. So these sessions are conducted every week by myself. And I make sure that their children are enrolled in good schools, the neighboring schools, and they are admitted into libraries. We do a tour of the library to make sure that we explain to them how the library works and all the programs that they can use for free. We enroll them in all these services and we are with them for at least a year to make sure they move around with confidence. We provide information about other essential services, for example, like food banks, clothing banks, opening their accounts in the banks itself, and to explain to them how they can communicate with Service Canada if required. So the guidance is there, the support is there, which even today they call and they inform us saying that we have been guiding them in the best possible way, and we made their settlement process very easy. All these services are ongoing, and we make sure to serve them in the best possible manner. Some of our other services include assistance for housing applications. Most of the seniors who may not have the capability of owning houses do have other options. So we make sure that we explain those options to them. We make sure we connect them with the housing facilities. We make sure we complete the application form if required. And we provide all this information and support to them. Information about seniors to access free dental care. Usually we do get this request from them requesting if there is any sort of a free dental care, because it's definitely, a hole in the pocket for them to go to a dentist. Canada, Health Canada, these websites do provide all this information, which then we print out the information and hand it over to them. Now, these programs and services are designed to enrich lives in the community. With your support, we are able to do this. With the support of IFT, Board of Directors, trustees, volunteers, staff, all these programs are possible. With a lot of thought process going into these programs, with a lot of support going into these programs. Our volunteers are always there for us, just a phone call away. Without their support, we wouldn't be able to manage these huge projects. We are looking forward to many more new inventions, many more new projects, so that we can introduce them to the community. We are a great linking resource to the community and the service providers. We make sure that we are connecting them not only for these services, but these days we are working on opening up a pop-up clinic at the Islamic Foundation of Toronto for the COVID vaccines. Very soon, once we have all this information, we are going to have this information on our website. All the upcoming programs will be on the website. If at all you would like to join our programs, please feel free to call us on the given numbers on the website, or also on 647-836-6264. We will make sure that we provide you the services that you require. Every individual is unique. Every individual has his or her own requirements and needs and necessities. We will try to do our best to stay connected with you, especially during these crises. And we are praying that you stay safe, stay home, stay safe, and if there's any help that you would require, please do not hesitate to contact us. And all this is possible with generous donations from donors like you. So thank you, donors, for making this possible, for growing this institution from brick to structure. So once again, please donate generously on the Islamic website. Please contact us if you wish to do any donations. Once again, Eid Mubarak to you all ahead of time. Stay safe, stay blessed, and stay connected. We are strong. We will come out of this in a very strong and possible way with the help of Allah subhanahu wa ta'ala. So once again, see you all during our Zoom programs. Thank you.
Allah, 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 Allah.